Don't rush them at once. They're going to stay in the room for the keynote. Thank you. And you know, this kind of conference, this is an opportunity day. What are the opportunities to create new companies? What are the opportunities to invest in? And so we're closing out with another opportunity, and I'm very, very pleased to have our closing keynote, Chris Boone of the Health Data Consortium. Chris is the new executive director of the Health Data Consortium. He's a recognized expert in health systems, health informatics, health IT policy, and the use of electronic clinical data to generate clinical and scientific evidence for public policy, quality improvement, and patient-centered outcomes research efforts. Prior to HDC, which is, many of you will know, runs the Health DataPalooza, Chris was a vice president at Avalier Health's evidence translation and implementation practice, where he focused on developing evidence generation strategies for professional medical societies, consumer advocacy groups, and life science companies. So here to talk about the future of health data is Chris Boone.
Do I flip it or do I tell them? I flip it? All right. Good morning, or afternoon for some of you. It is certainly a pleasure to be here. As Chris stated, my name is Chris Boone, and I'm the Executive Director for the Health Data Consortium. For many of you, you may not know, but the Health Data Consortium is a public-private partnership focused on fostering the availability and innovative use of health data to improve health and healthcare. I'm really here today because we are in the midst of a healthcare data revolution. And I think that every single one of us in this room and beyond that are watching via live broadcast have a role in this. In my firsthand experience, I've seen the potential of health data become a reality. I started my career basically building and designing clinical IT systems in a hospital. I then moved on to develop clinical data registries to support quality initiatives and quality outcomes, which is highly relevant right now. I've then moved on to Avalier, as Chris stated, to collaborate with life sciences organizations and professional medical societies to really determine strategies for collecting and aggregating data that could help with a lot of the R&D efforts of those organizations. Personally, I like to refer to myself as a data hippie. Most people always ask me, what exactly does a data hippie mean? Well, a data hippie in this particular case means someone who strongly advocates and believes in the liberation of health data. While this may sound like a good idea to some of you in this room, it is not, and it has not been, a widely held or embraced idea by many, hence the reason the Health Data Consortium was formed. The lack of transparency and access and the free flow of data continues to be a major barrier in healthcare. My goal is that by the end of this presentation, most of you have a better understanding of the current landscape, a better appreciation for the potential of health data, and that each one of you will become self-proclaimed data hippies yourself and join me in this movement. Is that fair? All right, so now I have to figure out how to work this thing. All right, where we go. We're living in an innovative time with new medical technology advancements. You know, the panel just mentioned that, you know, earlier this week, Apple announced that they were releasing this research kit. I think that's a great opportunity. It provides a framework for many of the innovators or entrepreneurs to really capitalize on the opportunities that exist in clinical research that could forever change how we do many of the clinical trials that we do today. But in addition to that, we still have cloud computing, mobile technologies, and social networking that have changed our daily lives forever. As a result, we're seeing more and more health data being generated by those various technologies. But at the same time, it's creating enormous opportunity for many of the investors and innovators to really think about new business models, new technologies, new ways of thinking of healthcare that historically we've never thought about before. But in addition to that, the role of the patient is evolving. Right now, you know, many of the current initiatives that you're seeing coming out of DC are asking that we have a higher level engagement from patients and consumers. Patients want to be able to be involved or actively involved in their healthcare decisions. They also want to own their data. But at the same time, surprisingly, most people don't realize that many people want to be active in ways and finding innovative technologies that would improve health for the overall population. The opportunities are just starting to be tapped. According to a McKinsey report, if the US healthcare were to use health data to drive efficiency and quality, they're projecting that we can save more than $300 billion, or roughly 8%. In addition to that, improving quality and cost savings, we're also seeing unprecedented investment in technology and health data technologies. Rock Health, or the venture capitalist, reported that digital health companies raised $4.1 billion in 2014, almost as much as all of the prior 3 years combined. But with great opportunity, there's always great challenges. These challenges, as you can probably see, none of which are probably new to you. Most notably, we see a lot of challenges. People talk about the lack of interoperable systems. They talk about the lack of technical standards, all which preclude the ability to seamlessly transfer data from one point to another. But one of the challenges that tends to not be discussed, that should be discussed, is the cultural and social norms within healthcare that preclude that ability to really embrace the new technologies that exist. Part of what we're doing with HTC is really promoting and advocating and educating people on the potential of health data and how it benefits every single one of us, but also how it could really potentially change the paradigm that we know in healthcare to be today. But we're still operating in a fairly resource-constrained environment. Despite the billions of dollars that were invested through the Recovery Act and the Affordable Care Act, we're still in need of modernization. It's very difficult for many of the regulatory frameworks to keep up with the pace of technology, which in many cases can stifle innovation. But most importantly, we cannot continue to embrace the status quo or embrace this idea that there's this natural, inherent resistance to change. It should not be understated that we've made some great strides in recent years, most notably at the federal level. There's been healthcare reform and other proposed legislation that have ushered in sweeping changes as it relates to access and reimbursement of care. These policies and initiatives acknowledge the important role that health data plays in changing and improving quality and reducing the cost of care for patients. Another concept that you heard mentioned, or initiative of legislation that was mentioned earlier, was the notion around precision medicine. There's also the 21st Century Cures bill that's been discussed. Of course, there will continue to be discussions around payment reform and care delivery reform and how that looks. But more importantly, the uncertainty that we have right now is in that pending Supreme Court decision around Obamacare and what it looks like that's slated for June. So that's something to keep on your radar. Meanwhile, there are several groups that are working pretty much in silos, which has been pretty much an industry norm for healthcare. But the diversity and number of stakeholders in health data are reflective of the evolving healthcare landscape. Many are working together, but the silos cannot persist the way they are today. Most of these guys need a cohesive voice to promote collaboration among health data, to bring innovative perspectives to the forefront, and to ignite continued innovation. We need to hasten this progress by working together to bring the benefits of connected, efficient, and quality healthcare systems to patients. And that's the role HTC plays. As I mentioned earlier, HTC is a public-private partnership. But we recognize in order to affect change and improve health outcomes, data must be embraced. All stakeholders must come together and really determine the most effective way to catalyze these changes. We collaborate and we bring other stakeholder groups together as well from all aspects of, whether it be providers, payers, innovators, researchers, foundations, and the like. But we're mostly focused on representing the intersection of health data, innovation, and public policy. But not just for the availability and use of data, but more so to promote the social change needed to embrace data. and to realize the full potential of the democratization of health data. We pretty much approach this with the three strategies you see on the screen. We're focused on open health data, data accessibility and liquidity, and patient privacy. Now, when we talk about open health data, most people use it as a synonymous term with government data. In some cases, it encompasses government data. And in many cases, HHS and other government agencies have taken a lead with making data publicly available. But it does include other data sets. For example, clinical trial data, or the open science movement that you're hearing about, or open innovation, as some people like to refer to it. But we're also advocating and pushing for data accessibility. And this is the concept that really focuses on being able to access data irrespective of where it is. We have various technologies that have been created. Health data lives in a variety of forms. So there needs to be some data liquidity, which is the free flow of data throughout the system, in order to promote the social change that we were discussing earlier. But there also needs to be a healthy balance of privacy. Obviously, we do not, HTC is not advocating to have each and every one of you identified in the midst of doing any type of clinical care or population health type of studies. But we are saying that there is a balance between privacy and a balance and research, and we just have to find where that happy medium is. At the Health Data Consortium, we know this is possible, and we're working with innovators and entrepreneurs every day in order to make this happen. And I'm going to tell you a little bit about more specifically how we do that. But first, I want to highlight one of the groups that I know that has taken the lead in much of what we're doing with health data, specifically open health data. RowdMap. It's a B2B solution. Their software was designed to track provider spending and quality measures and how it stacks up against competitors. Essentially, they've created a web-based platform that uses preloaded open health data, and it essentially publishes the organization's data, their competitors' data, and national benchmarks in order for organizations to really develop their own strategic plans around how to position themselves in this very competitive world. For example, if you're an accountable care organization, you probably want to have some better insight as to how your competitors are performing in the same market. This startup, RowdMap, has been a member of HDC for the last 18 months. They've seen growth where they started off with 3 people, now they're over 20 people. We've been able to connect them with legacy organizations that have helped them identify and refine their business models and identify additional funding streams to sustain themselves. Another organization is Purple Binder. Purple Binder is a great organization that I really like because first of all, they're based here in Chicago, but more importantly, they found a way to really be active in the social determinants of health, which is a term that we hear all the time. They use various open health data sets in order to make social services available in a geographic area, and that information available to everyone, from whether they be public agencies, whether it be the individual consumer or other nonprofits. They're capturing everything from food banks, data from food banks, home health aides, substance abuse programs, walking programs, grocery stores, or local park districts. This is one of the first social services platforms we've seen built on open health data. They've now taken it a step further and really started to expand their partnership network as it relates to the types of things that they can do. Of course, I have to give a shameless plug to the annual meeting for Health Data Consortium, which is called the Health DATAPALOOZA. Some of you may be familiar with it, others may not. But it is the ultimate example of how we convene stakeholders in the health data space to really discuss, to really promote idea sharing, networking, and for the most part, really being able to identify what the next Uber in healthcare really lives. This annual event draws more than 2,000 attendees from across the health data spectrum, including policymakers, innovators, researchers, providers, payers, and the like. But more importantly, we're bringing in the various stakeholders to really discuss the key issues and possibilities around health data. We've had Health DATAPALOOZA now, it's in its 6th year. We've had a number of great keynote speakers and panelists and presenters. But the one thing I want you to know is how the conference itself was formed. It was formed as a collaboration between the Institute of Medicine and the Department of Health and Human Services, who thought that there was an opportunity to really engage the innovators in the community, to really find out what the others are doing, and really to understand where the industry is going. So you'll see representatives from the White House, federal agencies, academia, the business, and the public health community. This year we're doing, this event is actually taking place on May 31st in Washington, D.C. If you're interested, please talk to me. We can talk about that later. But essentially what I want to tell you is that the future is truly enabled through health data. It is very bright. From the researcher to the physician, to the patient, to the insurer, we're seeing a health data revolution that is empowering the rise of what we call the patient payer or the consumer. Patients' online access to EHRs has nearly doubled in the last 3 years. Many of these patients and consumers are really demanding that more data be made available to them. However, what most people are not realizing is that it requires really a population-focused strategy, whether it be by geographic, whether it be by certain disease type or clinical condition, but there is immense opportunity. The next breakthrough can come from any point along the healthcare continuum, but we must foster the changes in the system that supports and incentivizes these changes. Because of our interconnectedness, we all play a key role in using health data and how it affects the healthcare industry going forward. Our members and others have embraced the health data liberation movement. And they truly are using this data to transform healthcare and how we deliver care today. In many cases, how we reimburse care as well. But the opportunity that we really want to be able to use health data for is in the ability to do much of the research and development activities we see on the back end. So there's a lot of immense opportunity in the secondary use of data. I call upon, and I started this off saying that there is a movement. I am a health data hippie. I want to tell you that this movement is still going on, and I ask that all of you to join me. So what role will you play? Thank you very much. Yeah, we can open it up for questions if you're interested. I think we have mics going around, do we? There we go.
Thanks very much for that. Arun Ranchad Life Sciences. I keep hearing terms and I keep hearing no definitions with these terms. Information, data, knowledge.
Yes.
Can you take a stab at defining those?
You know, can you hear me okay? I don't know if this mic is on. You know, when we talk about health data and health data liberation, we're talking about the raw data. There's still a lot of opportunity when it comes to the analytics associated with that data that converts it and makes it information that's relevant and usable by many of the key decision makers. So when we're talking about data, we're saying the data that's collected upon the point of care, or even self-patient generated data that you find in your Fitbit, Apple Health Kit, or whatnot. But there's definitely a difference between data and information. Data is in its raw form. Information is the data that's been transformed that can be effectively used for whether it be clinical decision making or some other type of decision being made in the industry. Is that where you're? Oh, and knowledge, yeah. And so what we're seeing right now is a great thing. You had Nancy Brown here yesterday. And I love Nancy because what American Heart Association is doing is they're taking a lot of the data, they're converting it into information, but the way they're converting it into knowledge is through a lot of their clinical practice guidelines. That is going to be very key. And it's also very key to much of what's taking place in accountable care. They're linking many of the quality measurement activities back to best practices, as some industries like to call it, what we like to call clinical practice guidelines or knowledge in healthcare. All right, thanks.